You're in your mid-40s. Your periods are changing, your doctor has mentioned perimenopause, and you've been on the same birth control pill for years. One morning, you wake up with a strange headache. Your vision looks off for a minute, and your hand feels clumsy. You tell yourself, it's just hormones. It's stress, I'm fine. But for women over 40, that mix of hormones, migraines, and blood vessels can quietly push stroke risk higher. In this video, we're going to unpack when it really is just hormones, and when those same symptoms are a red flag you should never ignore. Now, here's the part most women are never told clearly. Stroke is not just a man's problem. In the US, women make up the majority of stroke deaths, and about 1 in 5 women between 55 and 75 will have a stroke at some point in her life. And because women live longer, many have strokes at older ages, when they're already more fragile and more likely to lose independence. After 40, the story shifts. Your hormones are not doing the same smooth dance they did at 25. Perimenopause begins to nudge estrogen and progesterone up and down in waves. Blood pressure that was perfect for years can slowly creep up. Weight may settle around your belly even if nothing else has changed. At the very same time, some women are still on hormonal birth control, still smoking just socially, or still fighting off migraines a few times a month. Put those together, and your brain's blood vessels are playing a much higher stakes game than they used to. Here's where it gets tricky. Women's stroke symptoms are often dismissed, by others and by women themselves. A sudden weird feeling in your arm? I must have slept on it wrong. Words not coming out right for a moment? I'm just tired, I've got too much going on. Vision going fuzzy on one side? Probably a migraine, I'll push through. On top of that, doctors and nurses can sometimes label symptoms in women as anxiety, panic, or stress, especially if you already carry a diagnosis of migraine or anxiety. Let me ask you something, and be honest with yourself. When your body sends a strong signal that something is off, is your first instinct to slow down and listen, or to minimize it so you can keep taking care of everyone else? Most women I talk to say some version of, I didn't want to make a fuss, or I didn't want to be dramatic if it was nothing. But here's the brutal truth. Stroke doesn't reward politeness, it punishes delay. And stroke in women has its own set of plot twists. Pregnancy, preeclampsia, birth control pills, hormone replacement therapy, atrial fibrillation, and migraines with aura are all risk factors that either happen only to women or show up differently in women. So when you're over 40 and your hormones are changing, your personal stroke story is not a copy-paste of a man's. It needs its own map. Quick side note, because I want you to feel calm, not overwhelmed. The information I'm sharing comes from updated stroke education and guidelines from organizations like the American Heart Association, the American Stroke Association, and large stroke centers that specifically study how stroke shows up in women. My job here is not to turn you into a neurologist. My job is to take that medical language and translate it into clear, judgment-free English so that you can walk into your next doctor's visit and ask smarter questions. If you're a woman over 40 and you feel like hormones, blood pressure, and stroke risk are all starting to overlap in confusing ways, this channel is for you. We take hospital-level information and turn it into calm, practical English you can actually use with your own doctor. If that sounds helpful, go ahead and subscribe so you're not frantically Googling it 2 in the morning every time a new symptom pops up. In this video, we're building you a kind of brain risk dashboard for this phase of life. We'll zoom in on 3 big layers. First, how hormones and birth control can quietly change clot and stroke risk in women over 40. Second, how migraines, especially migraines with aura, interact with estrogen, smoking, and blood pressure. And third, how menopause and hormone therapy fit into the bigger picture with the classic risk factors you've already heard about, like high blood pressure, cholesterol, and weight.
By the end, I want you to be able to look at your own mix of factors and think, okay, here's where I'm actually at, here's what feels reassuring, and here are the questions I need to put on the table at my next appointment. Because this isn't about living in fear of stroke. It's about refusing to shrug off red flags as just hormones. With that foundation in place, let's start where so many women's stories begin: the pill, hormones, and that dangerous combination of smoking, blood pressure, and migraines with aura that far too many women are never warned about. So let's start with a question almost no one asks when the pill is first prescribed. This tiny tablet is changing my hormones every single day. What is it doing to my blood vessels? For many women, combined birth control pills, the ones with estrogen and progestin together, are safe enough when you're younger and otherwise healthy. But once you cross that 35 to 40 line, the math quietly changes in the background. Here's the key idea I want you to hold on to. Birth control doesn't float around in a vacuum. It sits on top of your real life. Your blood pressure, your weight, your smoking history, your migraines, your family history. And it's that combination that can nudge stroke risk up or down. Think of estrogen like a powerful dimmer switch. It can affect how easily your blood clots and how your blood vessels behave. In some women, especially those with other risk factors, that dimmer switch is already turned up. Add more estrogen through a pill, and the system can become just a little too eager to form clots. It does not mean that every woman on the pill is walking around with a time bomb in her head. That's not true, and it's not helpful. But if you're over 35 or 40, if you smoke, if you have high blood pressure, if you have migraines with aura, or a strong family history of clots or stroke, that's a combination your doctor needs to look at very closely, not automatically renew on autopilot for another 5 years. Let me paint a common story. A woman in her early 40s goes to her doctor and says, "My periods are getting heavier, my mood is all over the place, and my cycles are irregular." The quick solution? Let's keep you on the pill. It'll regulate things. No one sits down and says, "Okay, you're 42 now. You've had migraines since your 20s. Your blood pressure is creeping up. You smoke when you're stressed. Let's talk about whether this is still the safest option." Have you ever stayed on a medication or hormone because it's what you've always used without anyone really reevaluating it after you turned 40? That's not your failure. That's a gap in how we talk about women's health. Now, let's talk about migraines, especially migraine with aura, because this is one of those areas where a lot of women are walking around with a different level of risk than they realize. A regular migraine is miserable enough, pounding headache, maybe nausea, lights and sounds feeling unbearable. Migraine with aura adds a neurological preview before the pain. Zigzag lines, flashes of light, blind spots, weird shimmering in your vision, sometimes tingling or numbness or trouble getting words out. That aura means your brain's wiring and blood vessels are doing something a little extra sensitive. On their own, migraines with aura slightly increase the risk of certain types of stroke in some women. When you stack that on top of smoking and estrogen-containing birth control, you get a triangle of risk factors that many stroke specialists side-eye very carefully. Here's the frustrating part. A lot of women with migraines never hear this clearly. They hear, "It's just your migraines," or "Take this pill, it'll help regulate your hormones, it might even help your headaches." No one explains the vascular side of the story. I am not telling you this to scare you out of your medication. I'm telling you this so that the next time you sit in front of your doctor, you can say, "I'm over 40, I have migraines with aura, and I'm on estrogen-containing birth control. Can we walk through my stroke and clot risk together and see if this is still our best choice?" Because that's the real question here.
Is your current mix of hormones, birth control, and migraine history something you've chosen on purpose or something that's just been rolling along unchecked for years? Let's bring menopause and hormone therapy into this picture for a second. Menopause itself doesn't cause stroke. What it does is rearrange the risk factor furniture. Blood pressure tends to rise, cholesterol patterns shift, weight redistributes, insulin resistance can creep in. Some women start hormone therapy for hot flashes, night sweats, sleep, mood, or bone health. And again, the details matter. The dose, the type of estrogen, whether there's progesterone, and whether it's taken as a pill, a patch, or a gel. For one woman, a low-dose transdermal patch plus careful blood pressure control may be a reasonable choice. For another woman with a history of clots, smoking, or uncontrolled hypertension, the risk-benefit calculation may look completely different. This is why "my friend is on HRT and loves it" cannot be your only data point. So here's a simple 3-question checklist you can literally bring to your next appointment. You can screenshot this or write it in your notes app. Ask your doctor, how is my overall stroke risk at my age? Does my birth control, hormone therapy, or migraine history change that risk? Are there safer options for me now that I'm over 40? You are not being difficult by asking these questions. You are being an adult woman with a brain you'd like to protect. And if you're comfortable sharing, I'd love to hear this in the comments. Have you ever had your symptoms or hormone concerns brushed off as just stress or just hormones, even when your gut was telling you something felt different? You don't have to share details. Even a simple, "yes, this happened to me," can make another woman feel less alone. Now that we've connected the dots between hormones, birth control, migraines, and the changing body after 40, the next step is crucial: translating all of that into action in the moment. Because when something sudden and strange hits, a drooping face, slurred words, vision going sideways, the question is not, "Is this my hormones?" The question is this an emergency? So now let's bring this down from theory to the moment that actually matters. You're in your kitchen, or at your computer, or walking into a meeting, and something feels off. Your vision on one side goes weird. Your hands suddenly won't cooperate. Your words feel thick or tangled in your mouth. Your balance is off, like you just stepped off a boat. In that moment, your brain will want to bargain. Maybe it's my neck. Maybe it's my hormones again. Maybe I just need some water and to lie down. I want to give you a simple rule to override that bargaining. If it's sudden, if it's different, and if it affects your face, arm, speech, vision, or balance, you treat it as an emergency. Period. You've probably heard of the stroke acronym, FAST. A lot of stroke centers now use B FAST, and I like it even more. B is for balance, sudden trouble walking, dizziness, loss of balance or coordination. E is for eyes, sudden trouble seeing in one or both eyes. F is for face, one side of the face drooping or feeling numb. A is for arm, weakness or numbness in one arm or leg, especially on one side. S is for speech, trouble speaking, slurred speech, or not making sense. T is for time to call 911 immediately. Here's the twist for women. Sometimes there are extra symptoms: sudden confusion, a severe headache, sudden fatigue, or a strange feeling in the chest. You might feel off in a way that's hard to pin down. And because so many women are used to powering through migraines, periods, hot flashes, and anxiety, we're experts at talking ourselves out of taking those signs seriously. So here's how I want you to think about it. Migraine tends to have a pattern you recognize over time. Even migraine with aura will usually follow a familiar script: your usual visual changes, your usual timeline. Stroke is more like a plot twist, sudden, out of nowhere, often with weakness, facial droop, or speech change. It doesn't wait politely for you to ease into it. Is it always crystal clear in the moment? No. That's exactly why stroke systems of care are built around this idea, on the side of calling. Let me ask you this: and answer it honestly in your own mind. If you had a brand new, weird neurological symptom tomorrow, would you be more afraid of bothering the ER or more afraid of losing your ability to walk, speak, or think clearly? That answer matters because in real life, a lot of women delay calling 911 not because they don't know stroke is serious, but because they're afraid of being embarrassed if it turns out to be nothing. Here's the mindset shift I want for you. If you call 911 and it turns out to be a migraine, a pinched nerve, or a panic attack, that's a win. Your brain is safe. You go home. If you wait at home with a real stroke because you're worried about overreacting, the cost can be devastating. More brain damage, fewer treatment options, less independence later. So your personal checklist, as a woman over 40 who knows her hormones are changing, looks like this. Number 1, recognize sudden, unusual symptoms, especially anything with face, arm, speech, vision, or balance. Number 2, do not automatically blame hormones, stress, or your usual migraine. You can think, this feels different, and different gets checked. Number 3, call 911. Not your friend, not your group chat, not your regular doctor's office to see if they have any openings. Emergency services. If you're thinking, okay, but what if it goes away after a few minutes? Then I don't want to make a big deal out of it. That might actually be more dangerous. Brief stroke-like symptoms that come and go, a TIA or mini stroke, can be a massive warning sign that a bigger stroke is coming. Treat them like a fire alarm, not a false alarm. Now, here's your next reflection moment, and it's a big one. Who in your life needs to know this plan besides you? A partner, an adult child, a coworker, so they don't talk you out of going in just to be safe. Because when something scary happens, we often look to the person next to us to decide how seriously to take it. Sharing this plan in advance can make it easier for both of you to say, we promised, sudden, different, BFAS, we call. In the next part of this series, we'll zoom in on what actually happens if you do make that call, from the 911 dispatcher to the ambulance to the CT scan and treatment decisions in the ER, so that the process itself feels less terrifying and more like a team sport being played on your behalf. But before we get there, we still need one more piece for this video: how to pull all of this together into a calm, practical plan you can bring to your own doctor, and how to carry this knowledge without living in fear every time your hormones act up. Let's land this in the place that actually changes something: your next decision, your next appointment, your next "this feels weird" moment. We've talked about hormones, birth control, migraines, and menopause. We've talked about BFAS and why different and sudden is your red line. Now I want to give you a simple framework you can carry into real life, without walking around terrified of every headache. First, I need to say this clearly. I am not a doctor. I'm not your doctor. This video is education, not personal medical advice. Your own doctor or neurologist is the one who can look at your history, your medications, and your numbers and help you decide what's safest. Okay, with that on the table, here's a way to think about your stroke risk as a woman over 40 in 3 layers. Layer 1, the non-negotiables you can't change: your age, your sex, your family history of stroke, clotting problems or heart disease, and migraine with aura for some women. The classic risk factors you can influence: your blood pressure, your cholesterol, your blood sugar or diabetes, whether you smoke, and your movement, sleep, weight, and stress habits. The hormone-related overlays: birth control, especially estrogen-containing pills, hormone therapy for menopause, your pregnancy history, including preeclampsia or gestational diabetes, and how often you get migraines and whether they come with aura. Your goal is not perfection. Your goal is to lower the overall load on your brain's blood vessels. So maybe you can't change the fact that you're 48, female, and have migraine with aura. But you can work with your doctor on getting your blood pressure into a safer range, quitting smoking if you smoke, and reevaluating an estrogen-containing pill you've been on for 20 years. Think of it like this. Every risk factor you improve is like taking one brick out of the backpack your arteries are carrying up the hill. Here's a practical way to turn this video into action. Step 1. Take inventory. Grab a notebook or your notes app and write down your age, any history of high blood pressure, high cholesterol, diabetes, atrial fibrillation, or blood clots, whether you smoke, even only on weekends, whether you have migraine, and if you ever see aura or weird visual changes, and which birth control or hormones you're on and for how long. Your goal is not perfection. Your goal is to lower the overall load on your brain's blood vessels. So maybe you can't change the fact that you're 48, female, and have migraine with aura, but you can work with your doctor on getting your blood pressure into a safer range, quitting smoking if you smoke, and reevaluating an estrogen-containing pill you've been on for 20 years. Think of it like this. Every risk factor you improve is like taking one brick out of the backpack your arteries are carrying up the hill. Here's a practical way to turn this video into action. Step 1. Take inventory. Grab a notebook or your notes app and write down your age, any history of high blood pressure, high cholesterol, diabetes, atrial fibrillation, or blood clots, whether you smoke, even only on weekends, whether you have migraine, and if you ever see aura or weird visual changes, and which birth control or hormones you're on and for how long. Step 2. Book one focused visit, not a rushed by the way at the end of a visit for something else. When you schedule, you can literally say, I'd like an appointment specifically to talk about my stroke risk now that I'm over 40 and how my hormones, migraines, and birth control fit into that. Step 3. Bring a short question list. You've heard these before, but write them out and bring them. How is my overall stroke risk at my age? Does my birth control, hormone therapy, or migraine history change that risk? Are there safer options for me now? What's one concrete thing we can work on this year? Blood pressure, quitting smoking, changing my pill, or something else? You are allowed to stay in the room until you understand the answers. You're not too much. This is your brain. Here's your final reflective question, the one I really want you to sit with after this video ends. If you treated your brain with the same level of protection you give to the people you love most, what is the first change you'd make in the next 30 days? Maybe it's finally checking your blood pressure at home. Maybe it's throwing away that pack of just when I'm stressed cigarettes. Maybe it's requesting that appointment to review your pill or hormone therapy instead of just refilling it again. Maybe it's sharing BEFAST with your sister, your mom, or your best friend. You don't have to overhaul your whole life overnight, but you also don't have to keep telling yourself it's just hormones while a part of you is quietly worried it might not be. Let me leave you with the bigger picture. Being a woman over 40 means your hormones, your brain, and your blood vessels are all part of the same story. You don't have to live in constant fear of stroke, but you also don't have to ignore red flags and slap the label stress or PMS on everything. Knowing your risk, asking better questions, and taking your symptoms seriously is one of the most powerful forms of self-care you can practice. The information in this video lines up with what major organizations like the American Heart Association, the American Stroke Association, and large stroke centers teach about stroke in women, especially around hormones, blood pressure, migraines, and age. As new guidelines evolve, I'll keep updating what I share here so you're not stuck with outdated information. If this helped you see your hormones and stroke risk in a new light, hit subscribe so you don't miss the rest of this stroke series, including what actually happens in the ER during a stroke and what recovery can look like after 40. And in the comments, tell me one question you plan to ask your doctor after watching this video. That one question might be the start of protecting the only brain you'll ever have.